Hello, my name is Melissa Chang, and my topic is HIV/AIDS. Um, what is the purpose and objectives of this topic? So first, we need to analyze the global public health impact of HIV/AIDS, focusing on the disease epidemiology, transmission, prevention, and treatment. And this is the table of contents. So, introduction of HIV/AIDS. So HIV/AIDS is one of the most consequential health crises in modern history, affecting millions of people around the globe with far-reaching epidemiological, clinical, and social implications since its discovery in the 1980th century. The disease have claimed the life of millions of people that has triggered in unprecedented global public health mobilization with an estimated 42.3 million fatalities to date. HIV remains a significant worldwide public health concern. HIV may spread in every country in the world. According to estimate, there will be 30.9 million HIV positive individuals worldwide by the end of 2023. There are around 630,000 HIV related deaths and 1.3 million HIV positive individuals. Nearby 65% of the cases worldwide occur in sub-Saharan Africa, so making in the region most severely. There's like a table chart that shows the global HIV burden in 2021, and the most cases is in Africa. What is the cause of HIV/AIDS? So HIV is caused by the human immunodeficiency virus and retrovirus that target in the immune system. So HIV kill the white blood cell known as the CD4 T cell in the immune system. Territory as the number of CD4 T cell declines, the virus integrate its genetic material into host cell, using those cells to replicate and gradually weaken the immune system. So if left untreated, HIV progresses to AIDS, which is characterized by severe immunosuppression and susceptibility to opportunistic infection and certain cancers. What's the signs and symptoms of HIV and AIDS? So HIV infection progress through three stages. The first one is acute HIV infection, second one is a chronic HIV infection, and the last one is AIDS. So each with different symptoms. Okay, so on the first stage, flu-like symptoms, including fever, chills, or rash, might strike some person 2 4 weeks after an acute HIV infection. So from a few days to a few weeks, those symptoms might be paralysis, muscle pain, sore throat, exhaustion, enlarged lymph node, mouth sores, and night sweat. And other further potential HIV symptoms. You might not necessarily have HIV if you have those symptoms. And the second stage is chronic HIV infection, a stage that can last for years without noticeable symptoms, during which time the virus continues to replicate. During in extremely tiny quantities, the virus is still multiplying. So at this point, people might not be feel sick or exhibit any symptom. So some people will move through this stage more rapidly, but without HIV therapy. A person might remain in this stage for 10 to 15 years. In the final stage, HIV will gradually enroll your body defense, or leading to the development of AIDS, so acquired immunodeficiency syndrome. An advanced stage of HIV infection, if treatment are not received, tropical symptoms include rapid weight loss, persistent fever, chronic diarrhea, and night sweat. Without treatment, HIV can be transmitted at any stage of HIV infection even if the HIV infected person have no HIV system. And this is the picture that show the symptom of acute HIV. So what is the transmission of HIV? So HIV is transmitted primarily through contact with certain bodily fluid of an infected person, including sexual transmission. Most cases globally are unprotected vagina, anal, or oral sex. So anal sex carries the higher risk because of the fragile rectal tissue. Other transmission are injection drug use and sharing HIV contaminated needles of syringes, respectively. The provision of the threadly needles on syringes and auto injection equipment through needle syringe program is necessary to lower the risk of HIV infection and encourage drug injection to use sterile needle and syringe each every time inject. And we got the mother to child transmission. So during the pregnancy, labor, and delivery, HIV can be passed from an injected mother to her child through blood, bleeds, milk, or during childbirth. This is the picture that show how HIV is not transmitted and how HIV is transmitted. So what's the prevention of HIV/AIDS? So male and female condom are highly effective at prevention HIV transmission when used to consistently and currently during sexual intercourse. Condoms create a barrier that prevent the exchange of bodily fluid, semen, vagina fluid, and blood. And the needle exchange can provide a clean needle and syringe to injection drug use it reduce the risk of HIV transmission by minimizing the sharing of contaminated drug paraphernalia. And the last one is the pre-exposed prophylaxis and post-exposed prophylaxis. So the pre one is a medication that patients take to avoid contracting HIV infection from sexual activity, and injectable drug usage can be avoided by taking pre as directed. And studies have shown that a virus reduces the risk of infection by more than 90%, and the post-take emergency ART treatment with 72 hours of potential expose. So effectiveness decrease over time, so there is an urgent need for immediate action. So what's the treatment and management of HIV? The one is called antiretroviral therapy, ART. So the ART has transformed HIV from a fatal disease into a manageable chronic condition. ART suppresses HIV replication, restore immune function, and prevent pregnancy to AIDS when the immune system infection fighting CD4 cell are attracted and destroyed by HIV, so the body find it more difficult to fight off infection and some HIV related malignancies when CD4 cells are absent. HIV drug lower the quantity of HIV in the body, so known as the viral load, by stopping HIV from multiplying replicating itself. The immune system has a better chance for recovering and producing more CD4 cell when there is less HIV in the body. And conclusion. So HIV/AIDS remains a major public health problem that continues to affect the lives in millions of people around the globe, posing significant health, social, and economic challenges. Despite considerable advance in prevention, diagnosis, and treatment, millions still face barriers to accessing those events. So while events in ART are prevention strategy have dramatically reduced their impact, working with stigmatization, ensuring the equitable access to healthcare, and investing in research is important to ending the HIV epidemic. So, by integrating effective prevention measures, equitable access to treatment, and continued research into vaccine and medicine, the world can move closer to eliminating HIV/AIDS as a public health threat. So I'm gonna leave two questions here. So I hope you guys can answer my question, also give any opinion. So how can we reduce the stigma associated with HIV to improve prevention and treatment outcome, particularly in high risk um, populations? And the second question is, what the sum of the social, economic, and cultural factors that influence the spread of HIV in different regions? The last one, that's the reference. Thank you, guys. Thank you.